Is hair transplant surgery is a very risky procedure. Most of the guys are getting scared about this hair transplantation procedure. Kindly stay with me to understand what are the basics of this risk factors in hair transplant. Is it risky or safe? We'll evaluate. Well, there's a lot of news about hair transplantation surgery complications going around in social media and in the newspapers. Well, basically, social media creates a lot of awareness. Same times, it also creates a lot of havoc and even rumors also. So this news is partially correct, and most of the patient will understand in a different manner. Well, the hair transplantation procedure is definitely relatively very safe procedure when compared to many other surgeries, because you have a more awareness on the hair transplantation field. We've been doing this procedure a lot last 18 years, and it's very relatively safe procedure. One should not worry about it. So what are the basic risk factors that may happen in hair transplantation we really want to discuss today? Kindly watch this video until end to understand. What are the risks that patients are more worrying about in hair transplant? Basically, it starts with the pain, bleeding, swelling, allergic reactions, and infections. These are the five major things that causes more worry in the patients when they think about hair transplantation. When it comes to the pain, I'm sure if it is handled by a best surgeon, pain is very negligible, because today's techniques, what we are doing is micro FUE. Throughout worldwide is very much popular. When compared to our earlier days, we used to do something kind of FUT method or strip method, where stitching is involved, suturing is involved. Now there is no stitch and there is no cut method. That makes patient is really easy for the procedure. Even recovery is very fast. So pain is not a major concern when it comes to any risk factors in hair transplantation. When it comes to second thing, bleeding. So bleeding can occur during the procedure or after the procedure. Most of the cases, during the procedures, bleeding will occur than after the procedure. So there are few remedies surgeon has to take care, like pre-evaluate to test what is the bleeding and clotting time. And even during the procedure, there are protocols to follow what is the bleeding happening. So how do you manage it? What are the substitutes for that? So we can modify the treatment. That happens only with the expertise, experienced surgeon to evaluate the bleeding tendencies of the patient, or during the procedure, how to handle it. Only surgeons must be knowing about it. When it goes to kind of a clinics where doctors are not there, probably that could be a problem for you, and even life-threatening also. So, basic surgery principles are controlling the bleeding. Every surgeon must be knowing of it. So, choosing your surgeon definitely makes a very deciding factor on this. Other complication like a swelling is kind of a bothersome to some patients. Most of the people worried about swelling, kindly try to understand a little amount of swelling is definitely normal in any procedure. But we take some precautions to avoid swelling during the surgery, and second thing, even post-operatively, we also suggest you the sleeping position. If you try to sleep on face down position, because of gravity, you tend to get a lot of swelling around this periorbital, around this eye area. That's usually more bothersome to most of the patients. If you take all precautions, I'm sure out of 100 patients, one may get little swelling on the forehead and the eyes. One should not worry about it. It's kind of very much common in transplant surgery. And these kind of swellings would last hardly 3 to 4 days. Otherwise, nothing to worry much. So one should not worry much about this swelling after the post-operative transplant surgery. Furthermore, one of the serious complications would be allergic reactions to any tablet or injections during their transplant surgery. Most of the patients are not aware of this. They only think about bleeding, swelling, and other things, infections, but they'll forget about allergic stuff, because allergic reactions may happen very rare, because this local anesthesia used per day in Bangalore city, more than 50,000 to 1 lakh people will take it per day. That means that is that much safe. We need to give a test dose in the morning. We'll get to know if any skin rashes, anything, such that person has allergy to this kind of medicine. So we need to stop the procedure and defer the procedure. So, but still, why allergic reactions will happen in certain places is maybe they don't give test dose to the patients, or even they get mild allergy. A few clinics, they don't even inform the patient, they still continue the procedure, would lead to further complications. Provided doing all these things, we'll have enough time to handle all these complications so that your surgery will go very safe. If allergy happens and they still continues your procedure, then that would be a complication for you. A last one, but not the least, infections. Infections can happen immediately after the 48 hours after the transplantation, or maybe after 2 weeks, 3 weeks, 4 weeks. Usually, what are the infections that happens within 2 days, 3 days are more serious than infections happen after 1 month or 2 months, because these infections should be addressed immediately. Again, if you can follow aseptic precautions, a sterile environment, all this makes a really a very important role in not only transplant, you name any surgery, same aseptic precautions should be followed. After a couple of weeks, any kind of folliculitis, a localized infection in the follicles, which is very common, that can be negligible, I can say, and it can be treatable very easily. So that is the reason choosing a clinic who can give you post-operative support for at least 10 days is really very useful for you. So otherwise, one should not worry about infections that much. Most of the times, these complications are preventable like this before surgery. One point, what we do there, we do history. We do take complete history of the patient, and we do blood investigations. All other elements will be ruled out. Then we'll go for the next step is during the procedure. Also, we're going to do the test dose, and we keep on monitoring the what is the dose given to the patient according to the body weight, and what is the patient condition, and we also can give the IV fluids also. And a third one is post-operatively. After the surgery, 24 hours or 48 hours are very important. We'll keep on monitoring them. What are the reactions or what are the things? So, three phases: before surgery, during the surgery, even post-operative after 2-3 days. These are the critical phases where we need to focus on each and every patient. That way, you can avoid a lot many complications. And even if you get to know some complications, it can be easily handled. These are the protocols very important for any surgery. Let it be a small surgery, let it be a big surgery. The surgical principles remain same. So I would say it's a really safe procedure if you choose best clinic, best surgeon, and even if you choose with the best clinic, a best doctor, even any complication happens, they would be able to handle it, they would be able to assist you further, which will not deteriorate your health, whatever it is. Otherwise, it's the safest procedure that you can think about on getting it done.